Number one. So the item number one, the need to provide a 24/7 ambulance service in Tuam, County Galway. Deputy Colm Keaveney has raised this issue. The Deputy has 4 minutes to make an initial statement. Deputy Keaveney.
Thanks, Cancórla. The issue of staffing arrangements in the new ambulance space in Tuam is a concern to myself and indeed to many people in North County Galway who have for many decades now been aware of the fact that they live outside the optimum response time zone for ambulance bases in the county. And this issue has been thrown into sharp relief and contrast by the recent tragedy in Tuam. And may I extend and take this opportunity to sympathise with those families affected by that tragedy on Sunday. Through discussions with paramedics working in Galway, I understand that only 2 paramedics will be assigned to the new base. And this would then provide for 7 12-hour shifts out of a 14-day working cycle and 3 and 4-day blocks with gaps of 3 and indeed 4 over a 7-day working cycle. Minister, the plan appears to fill some of these significant blocks in the roster on an ad hoc basis. And I'm asking you today to acknowledge that this is entirely unsatisfactory, as anything less than a 24-hour, 7-day-a-week staffing of that base will be an equivalent to gambling with the lives of people in my community. Some months ago, Minister, there was a near tragedy in Tuam town and an emergency call went in, but no ambulance was free to attend from Galway, so one was dispatched from Loughrea. The response time from Galway, as you may be aware, is 25 minutes. The response time from Loughrea is 45 to 60 minutes. An ambulance coming from Loughrea and bringing a patient back into Galway will result in significant risk for that patient. In this particular case, as was the case of the recent tragedy, off-duty paramedics living in the community of Tuam attended the call after receiving an emergency call from the Gardaí to attend the scene. Minister, this is not an unusual occurrence that off-duty emergency medical technicians will be called in unpaid to attend a road traffic accident or a crisis in Tuam comparable to last Sunday. I want to acknowledge the dedication, the commitment and the action of the paramedics and indeed the Gardaí, and I think it's important, but the people of North Galway cannot be asked to be dependent in terms of their security, of their circumstances, to depend on the goodwill of public servants. From my discussions with the paramedics in Galway, I understand that the Tuam base would require 11 shifts to provide for a 24/7 cover and relief cover necessary to avoid overtime. A new rota for paramedics was introduced early September gone. Rotas since then have shown to me that shifts in the county are surplus to the staffing requirements of the existing network of ambulance bases. But I can understand that there is a particular emphasis on management to ensure that overtime isn't paid in order to maintain what one could argue is a phantom shift.
Just 1 minute.
In the week ending the 14th of October, there were 14.5 of these phantom shifts in County Galway. On the week ending on the 21st of October, there were 15 phantom shifts in Galway. And on the week ending the 28th of this month, there were 10 shifts that was what you could describe available, but not in action and in the county. Now, some minor amendments to the rota could allow for a 24/7 cover in the new Tuam base. And I understand that Galway has significant surplus capacity in shifts, and indeed there is significant surplus capacity in the Midlands and in Mayo. In fact, there are emergency medical technicians travelling from Tuam to service at Athlone and Mayo, where there are surplus shifts in the Midlands and in Castlebar.
Thank you, Deputy.
And can I conclude, Last Cancórla, say I have no wish to make a political point using last Sunday's tragedies, but the regret I would feel going home this evening, not to speak in the Dáil and to report on what I could believe are unavoidable situations that occurred because of a lack of personnel in my community outweighs the risk of raising this issue. I ask you, Minister, how soon are you prepared to convene discussions with the head of the ambulance service nationally to resolve the situation? Because solutions are available.
Come on, Minister of State, 4 minutes.
you very much, Lascaux. Can I thank Deputy Keaveney for his question, and before I give him the reply, to assure or to join with him in offering my personal sympathy. I know the sympathy of the House and indeed the whole country is with the tragic loss of those children to that family, and how traumatic and an awful event it was, and how deeply we sympathise with the family concerned. The National Ambulance Service provides pre-hospital emergency care and intermediate care services, stretcher-based inter-facility transfers to the people of Ireland. Pre-hospital emergency care is the emergency care provided to a patient before transfer to a hospital or appropriate healthcare facility. The National Ambulance Service, NAS, in line with commitments to a better, more efficient health service in the programme for government, is progressively improving and modernising emergency ambulance services. Supported by the Department of Health, the Pre-Hospital Emergency Care Council and HICWA, the NAS is providing national management and leadership, particularly in the development of 2 national control centres, the deployment of advanced paramedics, the move to on-duty rostering, and the dynamic deployment of resources within regions. Response times around the country vary significantly based on the nature of the area and the rural-urban mix, and the response times are longer in remoter parts of the country. In this context, NAS has developed a performance improvement action plan focused on achieving an improvement in response time performance. The NAS continues to deliver the best possible performance with the resources available. One of the key elements within this plan outlines that the service provider is not a static service and deploys its resources in a dynamic manner. The NAS therefore works on an area and national rather than a local basis. The dynamic deployment of ambulance resources ensures that the nearest appropriate resource is mobilised to the location of any incident. The Emergency Aeromedical Service, which was initiated in June 2012, is focused on the western seaboard in order to provide aeromedical support to emergency ambulances in relation to transit times from a serious or life-threatening incident to an appropriate facility. The EAS involves the Irish Air Corps helicopter supported by the Coast Guard. Based in Custom Barracks at Colm, the service has a dedicated helicopter with medical staff and with personnel to fly and maintain the craft. The NAS is responsible for patient care, which is provided by advanced paramedics. The Irish Coast Guard provides additional support to the EAS using its new SAR helicopter based in Shannon. This helicopter is crewed by Coast Guard paramedics, accompanied by an NAS advanced paramedic where necessary. Accordingly, there is coverage of the entire western seaboard if required. In relation to Tuam, emergency activity in the Galway area is reasonably static. Consequently, when Tuam Ambulance Station is finally commissioned, the NAS intends to use existing resources more efficiently to improve response time performance to the existing call volume. The NAS has been in continuing discussions with staff representative bodies on the introduction of tactical deployment of existing resources from existing ambulance stations to new locations such as Tuam. While such practices have been in place in other parts of the country for some time, Galway is one of a number of areas where this has not been progressed. However, this issue is now being progressed under Croke Park. The NAS is committed to better utilisation of existing resources in a tactical deployment model so that Tuam Ambulance Station can service the North Galway area. It is hoped that Tuam Ambulance Station will be commissioned and operational in the coming weeks.
Deputy Keaveney has an additional 2 minutes.
I'd like to thank the Minister for his response, and very cautious of not seeing the moment, the desperate moment that is experienced in my community with respect to the fact that there was no ambulance to bring 2 bodies. That the Minister for Health is not here to respond to my observations. I don't accept that progress is being made internally by management with respect to available resources to ensure that the ambulance base could be opened tomorrow morning on a cost-neutral basis. Cost-neutral with respect to having that base open immediately. I have absolute categoric evidence from existing rosters effective from the 1st of September of this year that there is capacity in the system to provide for a 24-hour service in June today. I welcome the fact that there would be a suggestion, Minister, in your response, that work is in progress with respect to a possible outcome of a 24/7 station in Tuam. I've heard, and indeed I think it's the first that the staff would be aware, that there is any initiative from inside the mechanisms of Croke Park that would provide for that. Minister, can I conclude? And I'm asking you to take personal responsibility on this. I'm asking that you would, as a matter of urgency, invite the head of the National Ambulance Service into a roundtable discussion with elected representatives from the constituency, where the elected representatives can put forward comprehensive proof from existing rosters that there are available staff across County Galway and the ambulance network between Roscommon, Mayo and Galway, that we could have a 24/7 operation as soon as possible. See, Minister, I'm not prepared to evaluate the next crisis and say, what if? What if the ambulance was here? What if we just had the ambulance? Because, Minister, that is unacceptable where we have the resources. And I'm categorically putting it on the record of this House that within the HSE West, within Galway, there is existing resources that would provide for an immediate, not a 12-hour, an immediate 24-hour service that would provide a critically important service to a community that's grieving this weekend.
Now, the Minister of State for a concluding 2-minute statement.
Sure. I would like to thank again Deputy Keaveney for bringing this before the House and to assure him that I will ensure that his comments, which will be published in the official, will be brought to the attention of the Minister on a personal level and to his department, and to take on board. And I will ask him personally to take on board, obviously, the issues which he has raised. They have my duty here is to give you a response, but it is their duty, obviously, to ensure that the wishes you have expressed there are met. And I would think that your proposition there is eminently practical. And I would repeat, just finally, Chairman O'Cahirlock, to say that the NES has been in continuing discussions with staff representative bodies on the introduction of tactical deployment of existing resources from existing ambulance stations to new locations such as Tuam. And I repeat, these practices have been in place in other parts of the country. Galway is one of a number of areas where this has not been progressed. However, this issue is now being progressed under the Croke Park Agreement, and obviously that is news, obviously, hopefully, that it is under active consideration, and I would hope that it will conclude to the satisfaction, particularly of the citizens of that area.
Thank you, Minister. Item number 2, the need to commission an